Have you ever needed a second chance at anything? How about life itself? Hi, my name is Stan Washington, Business Development Manager at the Opioid Mission in Houston. And for over 3 years now, Les and I have been together pushing this message of hope to the people in Southeast Texas who need it the most. His message has always been the life-saving drug, Narcan. My message has always been addiction recovery. But the bottom line is this: we both want to do whatever it takes to save lives. And what Tisha and Les are doing over at Gulf Coast Outreach Services with Narcan is truly remarkable. My hat goes off to them. And by the way, we have a network of collaborating partners who will be assisting us in the near future with a message of hope through addiction recovery. So please stay tuned for that. But right now, it's my pleasure to introduce to you a good friend of mine and the founder of Gulf Coast Outreach Services, Mr. Les McColgan. Thank you.
Hi, my name is Les McColgan. I'm the Executive Director of Gulf Coast Outreach Services, and I'm grateful to be here today. I had a real desire, once I got clean 5 years ago, to go and work with people that suffered from what I suffered with. I battled it for 40 years. Billions of doses of fentanyl came into our country in 2022, and the only thing that will prevent or reverse an opioid overdose is Narcan. I went to work with Houston Recovery Center, and I was the liaison for Galveston County and 5 other counties. And one of my responsibilities was distribution of Narcan. We had about 150 cases of Narcan, which is a lot of Narcan. And I was the only one doing that. I was the only one distributing or getting into the hands of the public the Narcan that we had. And I tried every way. I tried building distribution locations in different counties, passing it out when we do meetings, going to the homeless shelters and passing it out. But nothing really satisfied me. And so I didn't have the freedom that I needed at Houston Recovery Center because I had such a big territory. But I immediately looked at ways to get it into the hands of the right people. That was my concern. I could envision what would happen if I just had one county I was working in, and I could go through and do what I felt needed to be done, and that was provide distribution or access points throughout the county. I retired from Houston Recovery Center about a year and a half ago, and I immediately started my own 501c3. Stan and I have been working on that part of our next move. And so when I started putting this plan together, there were several things that were involved in planting this in Galveston County. We have a coalition with the health department and 2 or 3 other organizations, and we all work together about getting these locations. We use a small vending type machine, cost $150, $200, as opposed to $4,000 to $5,000. So it had to be affordable. I knew that some type of free access to Narcan throughout the county, if we could get enough free access throughout the county, we could actually see a decline in fentanyl deaths. And so we started with one machine, and it was donated to us by a friend. It was broken, and we put Narcan in it. And we have a billboard that says fentanyl kills, Narcan saves lives. And I changed that to free Narcan Heart Pharmacy. And we had about 50 people come in over a period of 2 or 3 days. And so we knew there's a combination of these things that's going to work. Our local affiliates of ABC and CBS and Fox News, I'm interviewed consistently by one or more of them. Been picked up by the Houston Chronicle, the Dallas Morning News, about what we're doing. They're not that thrilled with me. What they're thrilled about is the fact that what we're doing works, and it's duplicatable. It's duplicatable because it's simple. There's nothing difficult about what we're doing. We call it FDRP, Fentanyl Death Reduction Plan. And so we began to see a penetration into the market and began to experience a downturn in fentanyl deaths. And we got our first numbers last year, late in the year. Through September in 2022, there had been 36 fentanyl deaths. And through September 2023, there were 26. And so you have 10, and that's actually 28% decline in fentanyl deaths in Galveston County. And we're waiting for an update on our numbers, but we're convinced that they will continue. So it went from 207 doses, and that was in October, that were accessed and taken into the community. The next month, it was 383 doses, and that's right at 30 cases. And December was 330 doses. And so that's around 27 cases that went into our county by people getting up and going to these locations and taking the Narcan. And so this is the reason this works so much better than just passing them out, is because people know they have a need. They're willing to get up, get in their car, and drive down to the location and get the Narcan to keep it in case one of their friends, family, or neighbors, or whoever has an accidental overdose. And compared to me passing it out to somebody, it's effectively 10 times more effective, in my opinion. And so several things that we do. We use these small vending machines. We use flyers. We have a lot of media that covers us. Small signs, portable signs are good just to let people know. We have to let people know where these locations are. One of the best things that happened to us was our local newspaper. They covered us from the very beginning. And we are really, really grateful to the Galveston News. I mean, they wrote some fantastic stories about what we're doing and the approach that we're taking and the success. And from them, it spread to all other forms of media. And we also have our own app. Now, this app is under the name of our organization, Gulf Coast Outreach Services. But the only thing that I was really interested in with the app was a Narcan locator. I designed this and did not ask for funding because I wanted this to be in place, working, and I wanted it to be documented evidence that it was working. We now have that through the statistical data that we've got. So we are looking for funding, but the purpose of this was not just Galveston County. I love Galveston County, and it's a personal thing with me. I'm offended when people die of fentanyl death because it's unnecessary. But I also wanted to have something that I could share with other counties that need direction on making what you do the most effective possible. And that's what we're doing. But to the people that I've been able to work with in Galveston County, the wonderful people that have made themselves available for these little vending machines. And we're seeing lives saved daily from this. And so much gratitude to all my friends and also to the media. We appreciate all the support we've had in Galveston County, and now we're having other counties contact us, and we're here to help. We'd love to hear from you. Tisha Birchfield is my executive assistant. She takes care of all the media. You can contact us on our webpage, Gulf Coast Outreach Services, or our Facebook, Gulf Coast Outreach Services.